Hi, and welcome to another anatomy painting video. In this video we're going to be looking at the rotator cuff, a group of muscles that sits on the scapula and helps to rotate the shoulder and lift the arm away from the side. This group of muscles consists of the Supraspinatus, the Infraspinatus, the Teres Minor and the Subscapularis. Like many of the muscles in the body, the names for some of these muscles refers to their position or size or even their shape. As you can see, I've painted on a bony ridge onto the scapula, and it's about 2/3 of the way up the scapula. And we refer to this as the spine of the scapula. The spine of the scapula wraps around and becomes a bony point that we'd call the acromion process. There's a muscle that sits superior to this spine of scapula, and we'd call that the supraspinatus. The muscle that sits underneath the spine of the scapula is the infraspinatus. Now, when you think about our anatomical terminology, superior meaning above and inferior meaning below, these two muscles have a name that basically just tells you about their position. The supraspinatus is superior to the spine of the scapula, and the infraspinatus is inferior to the spine of the scapula. So their names will give you an indication of their position relative to the spine of the scapula, which is quite cool, I think. We also have the Teres Minor, a smaller muscle that sits just inferior to the infraspinatus, and the word teres being Latin for round, smooth, or cylindrical. There is also a teres major, but it's not part of the rotator cuff group, so I haven't painted it on for this video. The final rotator cuff I couldn't get on this video because it actually sits on the other side of the scapula, on the anterior surface of the scapula. And that would be the subscapularis, which helps to internally rotate the shoulder. Both the infraspinatus and the teres minor will create external rotation at the shoulder and horizontal extension of the shoulder. Horizontal extension is sometimes referred to as transverse abduction. And really it just depends on the terminology that you prefer. Perhaps more importantly though, these muscles will hold the humeral head tight within its socket, increasing shoulder stability and minimizing the risk of shoulder problems such as shoulder impingement syndrome. Many people experience problems in the rotator cuff, and it's vital that we keep these muscles strong and healthy, especially in a sporting scenario. And there is our showcase for the rotator cuff and the scapula. The picture's a little bit warped as I painted it on with my model having their arm out in a little bit of abduction. But you can see the acromion process coming around there, and that will actually connect with the clavicle to create the acromioclavicular joint. And at these muscles will get abduction from the supraspinatus, external rotation from the infraspinatus and teres minor, and we will also get horizontal extension, or sometimes referred to as transverse abduction. I hope you enjoyed this video, and thanks for watching.